What do you do to take care of yourself?
Welcome to the Unfiltered Healing Podcast with Dr. Rachel Hamill.
I ain't Dr. Phil. I'll truly help you heal your mind.
Connect with alternative medicine innovators that will challenge and empower you.
It has the potential to change your whole life.
Create natural balance for both your body and mind.
Your health is very important.
All while uncovering the truth behind modern medicine.
This is crucial.
It's raw, it's real, and it's unfiltered. Here's your host, Dr. Rachel.
All right. Well, Alina, welcome. Is it Alina? Did I pronounce that right? Alina?
You're perfect.
Okay. Alina, welcome to the Unfiltered Healing Podcast.
Thank you so much for having me on your podcast. I'm excited to be here.
Yeah, I'm actually really excited to have you on today. I think it's going to be like such a fun podcast because getting another practitioner on here that also has like knowledge and skills that I talk about all the time, that's like hardly anyone does.
Yeah.
So it's fun to find, practitioners where we have similar views and we do things similarly. But for anyone listening, anyone watching that may not know who you are, would you mind just giving a little introduction of yourself, how you got into what it is that you're doing and how you educate people currently?
Sure. So my name is Alena. I'm originally from New York. And I basically always was interested in health and wellness. I was a gymnast growing up, transitioned to being an Olympic weightlifter for very competitively for a few years. Went to school at University of Arkansas for my master's, got my master's as a certified athletic trainer, and kind of realized while I was there working with really high-level sports, specifically gymnastics teams, and track and all these different athletes, that these athletes were treated more like dollar signs versus like humans. So I felt that I could do better and I wanted to work more one-on-one. So after I finished graduate school, I took that knowledge, started to hear a little bit about postural restoration. I didn't get into it right away because I heard that it was very complex. Took a couple of years and eventually got into PRI while I was working in New York City. So during my PRI journey, I took my first course in 2018, and it's kind of just been going, taking different courses every year. I actually moved to Texas to really learn the information, and that was a very instrumental part of my life. And I really learned a lot about how to do PRI and actually implement it. And it really changed how I view movement, health, wellness, etc. So now, since living in Texas, I have lived in a few different places, and it's been such a journey. And I'm treating and working with people and trying to share the science of PRI as best as I can. And that's a little bit about me.
So did you specifically have, and you can explain what PRI is for people that don't know, but did you specifically have like your own experience of that before you started taking courses, or you just kind of heard of it and were like, oh, this is something I'm interested in? How did that kind of evolve?
Yeah, so actually it's pretty funny because I was a competitive Olympic weightlifter. So as an athlete at this time in my life, like I had been struggling, but I didn't really totally realize. So I took a course it was not about me. Like I was just taking a course to see how it could help my clients. I was personal training at the time, and Ron used me as a model because I was just so patterned. I didn't really know. I didn't really understand. And then, yes, I kind of had my own journey with my own internal health, my hormones, the inability to detox, if we could talk about that too. And, I'm still on that journey of trying to heal from years of stress that I put on my body from being a gymnast, being a weightlifter, living in a very toxic city like New York and working crazy hours. So my stuff actually was more internal. And at the same time, you can't have all this internal stuff without having other things pop up. So when it comes to looking at my pattern and me specifically, I definitely was a very strong pattern. And when I moved to Texas, we addressed it and I felt so much better. I didn't even really know that I was struggling from the PRI standpoint until I kind of addressed it. But the more I learned, the more I realized like, oh, my vision is not good, or, I'm not on the right prescription, or my need some help. And I did these techniques and I really didn't feel anything ever. So I did PRI myself for like 2.5 years without really feeling much. And then moving to Texas, I learned a lot more about how to utilize the system better on my own body because I was just so ungrounded, which makes sense because my body was like I was floating away. My hormones were showing it from, blood work. You could see it. So I didn't get into it for myself, but I did heal myself through it. This is the science. And now, of course, I use it. I use it every single day with patients, but I also use it on myself and I feel so much better. So
yeah, I think that's so important because we oftentimes people can get so familiar or comfortable in how they feel. They really don't know they can feel better, or they just think, that's their limitation or that's just how I am. And as we all know, there's always improvements that can be made if we have, the recognition and knowledge of that. Now, obviously these are kind of like different paradigms of you going to school and learning kind of this athletic training background and then being introduced to more of like a neurological brain, retraining, resensing. Was there like a lot of mindset shifts that had to take place? Because I know, and not all of it, I'm kind of generalizing here for a moment, but I mean, even just the paradigm of fixing a neurological pattern versus like stretching a tight muscle. I mean, was there a lot of kind of shifting through that process that took place for you?
Yeah, I personally am very open-minded. And I think that for me, when you first learn PRI, they teach it in a very biomechanical view. The first 3 courses are biomechanics purely because they have to teach it that way for you to understand it. And so for me, after taking those 3 courses, I had moved to Texas and I was already seeing my mentor, Casey Ratliff. I'll give her a shout out. She's absolutely amazing. She's in Fort Worth, Texas. But I already saw how she was implementing the dental and vision, and I had started to really talk to her about it. And so for me, I didn't have that big of a jump from understanding those first 3 courses to really understanding that it's a neurological system, because everything biomechanics is neuro. Whether or not people want to think it is another story. So when you're looking at range of motion of somebody, you're actually looking at the tension in the body and what the brain allows the body to achieve. So that's one like great example is like if you put somebody under anesthesia and you try and push them into different range of motions, they'll have all the range of motion in the world. So why, when the person is awake, why do they not have that motion? Because it's neurologically driven. So I think for me, I didn't actually have such a jump to understanding because it wasn't that I didn't really take cervical and occlusion on my own. I took it while I was around somebody who was already practicing at a very high integrative level. So as I was learning the didactic information, I was seeing it in person. So I had a very unique experience, which allowed me to understand the science at a different level. And I think that's the hard part with Instagram. And when you post things that I'm showing like these range of motion changes because of shoes or whatnot, people get really uptight about it because they can't understand how it could be, how these changes can occur, but it's really the brain. Brain is king. So if that's a hard concept to grasp, and that's a advanced concept. And I think that if you're listening and you're taking courses and you're not quite there yet, you have to be patient with yourself to understand that you'll get there as long as you're open-minded enough to understand that it is all driven by neurology. Anything we do, all our range of motion, all the different things we do, all our personalities and who we are is driven by neuro.
100,000%. Something I preach all the time. And similarly, you're just gonna find that when you flow in that paradigm. People can be on my table and they have like a tension in their leg, and I release something in their cranium because I'm a craniopath, and I'll say, okay, go get up and walk, and they're like, how does my leg not have tension? You did something in my mouth. I'm like, because I changed the brain pattern in your brain. It's just protecting that area. So yes, 1,000%. It's kind of going back to how can we best support and heal and the brain and its neurological function. Now, when you talk about this specific program that you did, they utilize, from my perspective of what you've explained, retraining the brain using these different senses of the body, which is very true, having done a lot of research myself. So what are the specific senses that they talk to you? Because you just mentioned briefly like the teeth, which we'll get into and stuff like that. But what are kind of overall the senses that they teach you beginning that process?
Yes. Sure. So PRI is one of their main focuses is respiration. So that's one of the fastest ways to reach the brain, fastest ways to reach the vagus nerve. There's tons of research on why breathing is vital and important for us, especially a long exhale and an exhalation with a pause at the end. And then we're doing the specific type of respiration while in specific positions. So we're compressed on one side, expanded on another side, etc. It just depends on what the technique is and what the goal is for that person, why we would prescribe that technique. Now, along with that respiratory aspect, we also are in certain positions in these techniques that allow us to feel certain reference points. For example, if there's a technique that is, let's say there's a right arm reach technique. So you're reaching forward with your right arm, which allows you to feel a reference point of left obliques. The left obliques is going to help you compress that left side and breathe into another side. So it kind of goes back to that, I'd say, positional respiratory techniques. So we're not just laying there and just breathing, even though there is a benefit to that, like in yoga, meditation, straight up breathing. There's, of course, a benefit to that. But we're using the breath a little differently by putting the person in compromised positions that they don't necessarily get to on a daily basis many times. Now, that's one sense that we use. Another sense we use is just bringing awareness to specific sensory elements, such as an arch on a foot or a heel on a foot, or different positions that allow you to feel a left glute. I'm just saying these muscles and these places because those are some things we reference a lot. So those are all references and different sensory pieces that PRI utilizes. Now, we also use things like eyes, teeth, and we can use ears, and they have started to talk about it. We do play with different things with nasal passageways. Now, those two, ears and nose, are not as known about. I know Ron knows a lot about it, but he hasn't given us as much just yet. I'm sure they're working on it. I just took a cranial course this weekend, and there was a lot in there about the nose. So I learned a lot about that, and that was wonderful. The visual system is a very quick way for you to hack into your brain. So your brain tissue is your eyes. So it is literally pushed out of your eye sockets during development. So your eyes and your brain are one. And you can play with different visual stimuluses by opening or closing one side, opening peripheral vision, or moving the head and the eyes in same or different directions, etc., and create a change to the rest of the body. So that is why many of us that are PRI providers want to work with optometrists specifically, sometimes neurooptometrists, sometimes regular optometrists.
Yeah.
Another element we really utilize is teeth. There's a PRI occlusion course to take that we can take with dentists to work with the dentists in conjunction to create guidance for the person if the person needs it by utilizing specific devices. So teeth, you have your periodontal ligament. That is very, very important. Your teeth have to touch properly. There's so many sensory elements in the mouth itself. And when teeth don't touch, or if I see cross bites, or if I see all these malocclusions, then I know that there's these external asymmetries that might not be playing a positive role into that person's ability to navigate through space properly. So those are kind of the big things that we learn while we take the courses and while working with other professionals to help with other people that might be struggling, to help with your back pain. So,
yeah, and it's pretty awesome that they're teaching that, because in my profession we know that 100%. But it is not very known. It's like, the way that I bite or this can affect, this. And it's like a process of just, yes, this is what affects this and all of that you're talking
Yeah.
about. And to reiterate, just going back for a minute, with just breathing, and then we'll kind of dig into each of these senses. Absolutely, it's not just diaphragm breathing. You have to breathe through your nose because that's where you exchange nitric
Yes.
oxide in your body. So that's like probably one of the biggest senses that I feel is just super overlooked is the head, the teeth, the airway.
Yeah.
That's not something I necessarily thought I would get into, but it's just a huge need, you know? And so when you find that and you're like, oh my gosh, everything is here, 80% of the nervous system is in the head and it's being overlooked, it's a huge thing. Now, I know you mentioned kind of briefly when you were talking about your journey, you said you noticed something specifically with your bite personally. So can you dig into what specifically that was for you? And then what have you seen change for your patients specifically once you started learning about we're just staying with like the teeth bite patterns? What did you see differently
Sure.
when you started evaluating that?
Sure. I'll go into my little story first. So I have a tongue tie. I was born with that. Certain people with certain genetic mutations may be more likely to have a tongue tie. I have the genetic mutation that links to it, MTHFR. And so I was born with that. And my mom did breastfeed, but she really struggled. Like I killed her. So that's a really big sign of a child who has a tongue tie. And I sucked my thumb till I was probably 5. So these are all tongue tie signs. I used to have super, super chapped lips. Even in 2nd, 3rd grade, like I was always licking my lips. I was always biting my nails, always had things in my mouth. And I look back now and I'm like, wow, would have been a really easy fix if it was
Right.
caught when I was an infant. But
Yep.
it is what it is. So, it's my story. It's part of it. There's always there for a reason. As I got older, because I sucked my thumb, I had a very vaulted palate. I know this now, but when I was 10, which is way too young, I got braces. And during the time I was in braces for 5 years, I also had one head injury, a pretty severe head injury with a concussion. And so, in my opinion, all of those things really led to my bite. I have a great smile. It's great. It's fine. But when you look at my bite, you could see that I have a class 1 bite on one side and a class 2 bite on another side. And I have a decent midline shift. I don't have any bite that's really crazy. My bite's not crazy, but it's almost as if I have a very asymmetrical bite with 2 bites on each side. We see this a lot. This is not that uncommon. I have a pretty vaulted palate and my tongue does not rest on the roof of my mouth. These are just things that I know about myself because I've really gone deep into it.
Yeah.
So with my correction, right? A lot of dentists would say, oh, you need ortho. I would not do that personally. I just sleep in a specific guard, mandibular appliance that was made for me by a dentist that understands PRI, and I did not get it immediately. I did PRI first for almost 2 to 3 years before getting an appliance, and I want to be clear on that because a lot of people think they should go directly to the dentist, and I really believe that you should go get assessed first. It's like you go every year to your doctor, and the doctor tells you, oh, your cholesterol is not good. Look into this, or you might have something wrong with your heart, go see this specialist. I hate the idea of all these specialists personally, but when it comes to it, PRI practitioners are generalists in a lot of things. And you really should go to the root and find the root of your issue first before just diving, oh, let me go to dental, let me go to vision, etc. Because they're only pieces of the puzzle. And if you don't have somebody helping guide you, then that's going to actually backfire, in my opinion. So that's my story with my bite. I sleep in that appliance. I've slept in it every single day in the last almost year and a half, except for 2 days. And the funny part is on those 2 days, I left it at home. I was at a wedding. I rolled my ankle twice in that weekend. So it just goes to show you that my center was so off and my back hurt, which is something that, I experienced as a gymnast. So, that's kind of my bite. Now, I definitely see this type of bite in people. I see a lot of intorsion. I see a lot of malocclusions in people, especially in modern society today, especially in New York City. I see way more issues in New York City with people. They tend to just have more problems because New York is very toxic, in my opinion.
Yeah.
Just the environment itself. It's a strenuous environment to live in, to work in, to, have a family in. So in my opinion, people in New York happen to have a lot more compensatory issues. So the bite, people grinding is something I see all the time. Different teeth being pulled, teeth pulled prior to braces. That was like something that happened a lot, maybe like anywhere from 15 to 40 years ago. Like that's been a big trend. I don't think dentists are doing that nearly as much now, but I still hear about it and still see it. So teeth being pulled like collapses the jaw, and kind of difficult. It's really difficult for people to rebalance themselves after they lose their premolars. And if they lose their canines, it's honestly even a bit worse, of course. But so I definitely see all these different malocclusions, but that's not to say that I can't get them better first with techniques and at least relieve the pain. And there are people that have teeth pulled that don't need dental appliance. So I definitely think that it's so case by case, but that's why it's really important to find a practitioner who's knowledgeable in it. And the hard part is there's not that many people out there because PRI is small, and it's really hard to learn PRI to the top level. So that's why I push my content and try and help people and hopefully have newer things coming for the future to just help people understand that this is, it's neurological and there's more to it. But yeah, that's a little bit about my story of what I see with clients.
Yeah, I'm in the same boat because a lot of people say they do cranial work and they have not even done close to the level that I've learned and can do looking at the whole nervous system. So this is why we do push this information, is because people are suffering. And I have such a similar story, tongue tie, airway, braces done early. But for me personally as well, I took several years doing lots of conservative things before that, retraining a lot of things, with myofunctional, tongue tie, all this stuff. I wore an appliance for years as well, similar mandibular appliance, working with some functional dentists, but I didn't want to wear that forever. So I ended up just going and getting my bite fixed. But I had done all those other things prior, and it's still not perfect. I know that there's some postural stuff I still need to work on after changing my whole structure of my face. But a lot of people go right to that and they're just like, no, I'm going to fix a tooth. I'm going to do this. And I'm like, no, there's so much stuff we got to do first. So
there has to be prerequisites. You're not going to go take a biochemistry course without ever taking bio. It's just, there has to be prerequisites. You can't just go jump straight to the dentist, have them do this, because they're only zoning into your teeth. What about your neck? What about your rib cage and pelvis underneath that neck? What about all these systems that work with those teeth? So just to get people thinking. Yeah.
Two different organs. And they also, just to digress for a minute, we're mostly talking about mechanical things as far as the brain and neurological system, but even teeth in general, they all have an organ relationship too. So if you're pulling teeth or a tooth is, infected, or it's so much stress from clenching and grinding on a specific area, that also affects so many other systems of your body. So zoom out, zoom out and see what that's all affecting as well. Now, as you're kind of explaining all this dental language, which I know because I've been trained with dentists and whatnot as well, did you have to specifically, was that all kind of stuff you learned in your courses? Or did you specifically also get trained from dentists on, because some people listening will be like, I don't know what class 1 or 2, we know because we work with this stuff, but is that some stuff that you had to learn? Because I know personally, I didn't know anything about dentistry until I started learning about this. And then I had to study under them and I had to learn what they were doing. The good ones, So did you have to learn that as well? Or was that something they also taught you?
So I did take the PRI occlusion course, which definitely teaches you some information, but it's not the same. Just 16 hours in a course that teaches you about some bits of dentistry is not the same as sitting and talking with dentists. So I am very fortunate that one of my best friends is a pediatric dentist. So when I took the occlusion course, me and her probably sat on the phone. In general, we were talking all the time. She's one of my close friends, but we started to talk a lot more because I was very interested in her profession and what she learned in school. And she went to UPenn, which happens to be I think, more progressive school, because what she had learned about palatal expansion as for children really lined up with what we were learning, what I had heard from with PRI. Now, that is one thing I'm fortunate about, but also Casey really, I saw a lot about how she was working with the dentist in Texas. I got to do some cases with her, watch her do those cases, watch her interact, and I really got to meet the dentist. And then I also did my own journey first. So I did my dental stuff before I worked with anybody with their dental appliance. I basically fitted myself for an appliance before I fitted anybody else for one. So that was really helpful. I also have had my podcast at this point. I interviewed a few dentists. Dr. Lecco was on there for an episode, and that was, very beneficial. So I do think I got a lot out of the PRI courses, but I also got a lot out of watching, learning, shadowing, being there. And that's my specific journey that's hard to replicate for some people because they just don't have those resources. I do think that is for me, at least, the best way to learn is to be there and learn. And that was really how I got a lot of the dental knowledge. Now, I'm not a dentist, and nor do I ever claim to be, but can I speak to a dentist on the same level when it comes to bites? Yeah, because they'll trust me. Mm-hmm. When it comes to like some other things with dentistry, of course, I don't know. When I just had my guard refitted last week, I kept telling her, I feel my canines. She was like, no, you feel your premolars. And I was, so when it comes down to it, like the dentist ultimately will see what they see, and they're the professional with it. So you have to take their opinion, trust their opinion. And she was right. And the way she fitted it was perfect. So I think that it's a collaborative effort when you're actually doing those sessions. But when it comes to the learning process, I just tried to go out there and learn as best as I could with the resources I had.
Yeah, same. It's so important to be a team with any of your healthcare providers together. Our goal is to get that person better. So the dentists I work with, they rely heavily on me telling me things, and I also rely on them to tell me things. So it is just like you're saying, doing this collaboration together, because going back, we know that this sensory area is hugely dynamic for the rest of posture in your body. What are some things that you see, and we'll get off the teeth in just a minute, but what are some things you've seen with your patients kind of looking at some of those bite patterns you were talking about posturally with them? Because I know personally, but what are some things you see?
Sure. So with cross bites, I see a lot of cross bites with scoliosis, actually, which makes a lot of sense. You'll see cross bites actually tend to also come with a visual component, tend to see strabismus, lazy eyes, different things with a visual component that has to do with having a crossbite. There's a lot of research on that too, which is interesting to read. Different other issues you'll see, a lot of it actually goes back to vision. You do see a lot of dental. I notice a lot of people that have a dental component when there's something actually pretty obviously wrong dentally, they tend to also have a visual component, but it doesn't go vice versa. So a lot of times people that just purely have a vision component, they don't always have a dental component. You'll see different things, like if somebody can't reference their molars very well, they don't feel their molars, they'll be very in their toes because they're only feeling their canines. So they'll be kind of falling forward on their face. Whereas if somebody only feels their molars, you might see a very forward head posture. There's so many different things that you'll see that attribute, like that go back to that bite. So yeah, those are probably the main things I see. If somebody has a lot of intorsion on the right side, they might really be leaning over their right side. They're never able to go left. If they don't feel their left molars, they're probably not able to go left very well. If they're really only trying to think what else, there's always so many. But those are the main ones, I'd say.
Yeah, there's lots of possibilities. And vision is also huge. I mean, it all goes together because it's all in the brain. It's the environment of the brain, oxygen delivery, all that stuff. Do you personally do like visual exercises, trainings, and what you do, or is that something you kind of screen for and then refer out to get more rehabilitation there?
Yeah, so postural restoration has specific techniques that we do with vision that are visual components. There's some from the vision course, and then there's some from cervical cranial courses. So I do those techniques for sure. And then I do refer out. I work with SUNY Optometry, which is a pretty well-known school in New York City. And that's been such an amazing experience to work not just with the doctors there, but also the residents and the interns. And it is so cool how open-minded they are. You know, from what I've heard about with other optometrists, sometimes optometrists are a little bit shut off to this, but I have not had that experience. I have had the best experience with my optometrist. I absolutely love working with them. And they are neuro-optometrists, so they love working with the brain. And I go to those appointments with my patients, and we collaboratively come up with what prescription should be used by using the testing, the body. I use different specific techniques. I'll do before and after. We'll try a lot of different things. We're really learning from each other when it comes down to this, because ultimately what they normally see are people with like brain injuries, strokes, a lot of really obvious brain problems, really obvious visual issues that have come from those brain problems. Whereas the people I'm sending them are people in pain that I need to use the visual system to get their body out of pain. So it's not like what they're normally used to seeing. And they always tell me, the optometrists and neuro-optometrists always tell me that my people sometimes are more complicated because you're treating pain. You're not treating a stroke. That's more straightforward than big glaring issues. Whereas my stuff is like, oh, this hip pain just won't go away. So it's been a really awesome journey. I've been working with them for about a year. I love it. I love working with them. Huge shout out to SUNY Optometry.
Yeah, that's super
I'm
cool.
like their biggest fan.
I have a couple people here that they're neuro optometrists too. I wish I had the time to like go to the sessions with patients.
It's hard.
So busy, but I went through that whole program myself too. So, you know, we're like we talk about, we go through all of this ourselves usually. And it is like, you know, even if you don't have brain injuries, which is what they're seeing most of the time, but also things with kids like learning disabilities, dyslexia. For myself, it was, you know, all this stuff I had early on. And then you go into like 8 years of graduate school training where you're looking at screens and boards and straining your eyes for 8 years, and you think that's not going to affect your posture, you better believe it's going to affect your posture. So you have to like, you know, get again out of that paradigm and be like, oh, it's not just we're putting glasses to fix this. It's like your brain is putting these muscles, these areas where they are, and that has a huge effect on your posture, a head tilt, headaches, all where you're biting, like you're talking about.
Big. It's big. I mean, you can make such significant, with both teeth and eyes, you can make such significant lifelong changes. And what we tend to see a lot are people that are just in glasses and very overcorrected. And that can create so much tension. And when you take that away from somebody and you give them that decrease in tension, they get their life back. They're not, struggling in pain every day. So it's been really cool to work with them. And with vision, there's no PRI vision course anymore. So I didn't have as many resources. And it's not like teeth. Teeth you can look at and be like, oh, okay, this canine's not touching. These molars have a issue over here. This tooth is not there. Like that might be a problem. Whereas with vision, it's like, I have so much respect for these optometrists because I don't understand how they can look at an eye and be like, okay, this is the script and this is what the eyeball is doing. And it is amazing to me. I'm fascinated by vision. I like teeth a lot, but I think my last year, I'm just actually fascinated by the work that they do and how it can make these significant changes on the body. So I really work with a few optometrists there. So
I remember the first one I went to is when I lived in the Bay Area before here. And that's where I was introduced to it. And I remember him telling me, oh yeah, your gluten sensitivity or something like this is caused from your stress in your eyes. And I was like, what? And he's
Wow.
like, yeah, your stress in your eyes is causing so much of your nervous system to be in sympathetic mode all of the time that it's putting a significant stress on your body and your digestive system. And I was like, wow, I've never ever heard an optometrist talk about anything of this nature, And it just like switched something in my brain, obviously for me with vision, like, and then you talked about, if you correct one eye or do LASIK in one eye and they're not meeting together, like that further stresses your brain and puts it more in parasympathetic. And then you develop all these patterns. So absolutely, vision stuff is super fascinating. And I got into, I don't know if you've heard of, why can't I think of the name of it? Quantum neurology. So it's called quantum neurology.
Okay.
And
I might have heard of it, but I don't know enough about it.
Yeah, it is. You can get real deep in there. But I started playing around with that, which is basically just using light therapy through different exercises, like for instance with the cranial nerves to help redirect the cranial nerves. And I've done that with my vision people. And they're like, with cranial and just that, retraining the muscles, they're like, wow, their vision prescription totally changed, or like this totally changed.
Wow.
So to go back, eyes absolutely, like with anything, are super fascinating, super important, and can affect lots of different things. So that's a fun topic.
Yeah. I agree. I think there's so much to it and we just don't know yet. And so we have to just learn and ride the wave.
Yeah, it all goes back to the brain. What stresses your brain? What stresses your nervous system? We're looking for anything that's stressing all those sensory things and putting it into sympathetic. And it's hard because we're so bombarded. Like you talk about New York, it's like anywhere you can be bombarded. So we're just trying to get all those senses balanced,
Yep.
Yeah.
Agreed.
Well, let's go down the body a little bit and talk about the feet, which I know can be
Sure.
a real
Controversial topic.
subject.
I don't know why this is such a hard. I think it's funny, to be honest, because I state my opinion, and then anytime I talk about shoes on my content on Instagram, people have a problem. But that's fine. I just want to get people thinking, and I wore barefoot shoes for 4 years, so I get it. Yeah. But I also understand what it's like to feel really good in my body now. So,
and that's the point. Everybody's different,
Yeah, everyone's different, and I think that it's funny for shoes to be such a controversial topic. I just think it's funny.
Oftentimes the most random things are the most controversial topics. So and you're just like, I don't understand, but we're going with it. Yeah. So we know that the feet, again, just like other areas, are huge sensory parts. Lots of what are called proprioceptors and mechanoreceptors are there, which sense motion and position of our body. So what are some common patterns you see, not talking about shoes yet, what are just some common patterns you see specifically for the feet with postural nerve stuff?
Sure. So I will see a lot of right arches that lift upwards and big toes. Right big toes are like not on the ground. I'll see a lot of toes that the big toe and the rest of the toes are like splayed outwards, which actually comes back to the teeth, and that usually is correlated. I'll see a lot of people that will say they really feel their heels on the ground when they're really like floating forward because it's the body compensating to come back. And I'll see a lot of flatter and fatter left feet. And so we're asymmetrical internally. So these asymmetries can show up externally. So if you're primarily standing on your right leg and maybe falling over to that right side, that left foot is going to flatten and fatten to push you over there to the right. So I definitely see these asymmetries in feet a lot.
What was it about, you mentioned the feet, you said being splayed has to do with the teeth. What specifically is that?
I think just in the occlusion course, Ron talked about anterior open bites and how there's a real big correlation to big toe and the rest of the toes having like a space in between the big toe and the rest of the toes. So I always thought that was so interesting, and I tend to see that.
Yeah, I'll have to look at that now because I didn't correlate those, but that makes perfect sense. Open, front side of the body.
Yep. Yeah. Wild.
Yeah, it's wild. What about, okay, so we see postural things with the feet. What about things that people do to their feet? Like, women wearing high heels and things of that nature. Oh, boy. I know.
I'm all for wearing it's fine. Wear a good shoe, wear a nice high heel once in a while, but people that wear high heels every single day, like you are ruining the rest of your body. It's not just about your feet. Your feet are being squished into a tiny little shoe. They're squished where you're putting all your body weight onto the ball of your foot, which is not how we're supposed to walk. And you should have a heel strike. How are you having heel strike if you're on a point at the back of your foot? So I have a hard time with the high heels with people that wear them every day. But look, I mean, I don't wear heels anymore. I stopped wearing heels when I was younger because I had some low back discomfort from being a gymnast, so I was smart. I love the brand Echo. I think they make a great shoe they're really cute and they're good for like going out. And they have nice boots, and I like that brand. I just think that people care a lot about fashion. They want to wear a specific shoe, but yeah, heels are just not, in my world. Heels are just not okay. But it's really also up to what the person wants to do. If you're in pain and you want to heal, as in heal your body and feel better, you're not going to go out and wear, Louboutin heels. It just depends on that person's motivation in life. So I don't like heels. I love a shoe that has a really great heel counter, which means it holds and cups the calcaneus nicely, which allows for better position of the heel bone, which allows for even better position of the talus bone, which the talus bone tells the rest of the body pretty much, or the brain, if the arch should collapse in or lift up, etc. So if the talus is in a good position, then we're not going to have these collapsed, flattened arches. We're not going to have these really high arches, which both mean different things. Basically, not necessarily different things, but person's just not grounded. So a good talus position is going to help ground that person. So a really good heel counter on a shoe, and then a really nice arch support to allow for foot to pronate, which means flatten the arch into the ground and then be able to push off so that you can laterally move from one side to the other. So those are the components I look for in a good shoe. PRI puts out a shoe list every 6 months. And those are pretty important things when it comes to good shoes. But yeah, heels are just a no-go, and Nikes and Adidas and what's the other one? Under Armour. Those shoes are just awful. They do not make a good shoe. So I hate to break it to the 16-year-olds out there that like they're not fashionable Nike shoes, but I get it. I was 16 once too.
Yeah, I wore terrible shoes just for the sake of fashion. So, and it's not just high heels, although high heels are pretty terrible neurologically as well. Yeah. A lot of those shoes, like you said, they just squish the toes together. And so that creates so many problems. Now, when you're working with stabilizing the feet, and obviously you're looking for whole brain nervous system stabilization, is it also a process of you working with those individuals of strengthening certain muscles in the feet, things of that nature? Because I know there's also the point of, with heavily reliance on some of those arch supports or whatever it is that weakening some of their possibilities for their muscles, or is it more of this is a process of getting you out of something, then strengthening certain things? What's kind of your process? Obviously, it's case dependent, but what's kind of your methods?
People will say like, oh, if a person has ankle problems, like they should be doing all this foot strengthening. I don't know how I feel about that. I think that it's great to walk out on the beach in the sand, move your feet through full range of motion on an uneven surface. I think if you can go outside barefoot, that's awesome, but it has to be on an uneven surface. I don't do any specific foot training. I came from being a gymnast. Like my feet were really strong, grip the beam. I think that there's different things you can do with your feet to keep them strong. I don't think that's going to change how they understand their surroundings, if that makes sense. I think wearing a shoe for the majority of the time, if you're in pain, I want to make that clear that if you're healing from pain or you're healing from something, you need to be in a good shoe so that you have those sensory systems, arch and heel counter for your brain to understand how to move. I tend to see people's feet get stronger from having an arch support than weaker. And it's not that you're relying on an arch support to help hold the arch up. It's nothing like that. You're using it as a brain reference center. So the brain understands, okay, there's an arch here. I'm going to be able to pronate. I'm going to be able to flatten this arch and move through full range of motion. But I'm not opposed to somebody going and doing strength work on their feet.
Sure.
There's there's something called the Noboso that people started to put in their foot, in their arch. And it's like all these like prickles. It's like a little plastic insert, silicone, and it's all these prickles. Now, all these people message me, oh, what do you think about the Nobosos? I hate them. I've seen them now on 3 people. I think they're awful. I think the brain thinks that it spikes into your feet and the brain cannot adapt to that sort of
danger.
Strong. Yeah, it's danger. It's danger. The brain thinks it's danger. So I don't like things like that. I think you should walk outside in nature and maybe go barefoot around somewhere, or wear a barefoot shoe if you're going to go hiking where you're going to be on an uneven surface. I'm all about that. So I don't necessarily think you need inherent strengthening for it, but I think you could do that if you want to, but just be in a good shoe for the majority of the time.
Yeah, good healthy balance between both. Like for me personally, I have barefoot shoes when I hike, and then weightlifting, I also always go barefoot. And I think it's just because I get better grip and strength and position that way. But that's not for everybody. You know, some people need better posture rehab to do those things. So always individuality is key for everything. And your mention was that barefoot is great for uneven versus wearing barefoot on flat ground for a majority of the day is not optimal in your opinion. Was that correct?
Exactly.
Okay. That's great. Are there other, like, any other big kind of no-nos or anything else you see that affect anything else sensory wise? What about, like, do you see anything male or female differences specifically in the work that you do?
I'd say any more what?
Any like specific patterns that you see more commonly in women or men, or?
I don't know about patterns necessarily, but I'd say women struggle more overall from what I've seen. Not saying men don't struggle. I don't want to be like that I don't want to be so clean with that response, but I would say women tend to struggle more because we're cyclical beings and we have more hormonal components. And I think that can really play a role with sleep, recovery, how we feel. And I don't think men have the same, they don't. It's not that I don't think. They don't have the same cyclical component. And so when it comes to feeling better, healing, sometimes I feel like women have it a bit harder. So that's kind of my biased view on it. I think we all know that we're cyclical and things can be a little harder. And it's the same when it comes to healing from something. But other than that, pattern-wise, I might see more laxity in women than I do men. So just general laxity, which is also a pretty studied topic. I definitely see that. More hip internal range of motion. Men tend to be a bit more tighter, which I like tighter. It's easier to treat, but.
Yeah, it's harder to build muscle stability around for sure. Do you, is that something you also assess then when you're working through your protocols with people? Like it's not just structural stuff. You're also saying, okay, I see a lot of ligament laxity. Like there may be some hormonal, nutritional things. Is that something you also address as well?
Yeah. I definitely check laxity when I'm looking at range of motion on anybody. I do have, I do a lot. I know a lot about detoxing, and I I'm not an expert on that, but I do give some of my opinions to some people who come see me, and I use certain protocols for it. And if I feel like they're the right person who could benefit from it, I will give them my information to do that. I use something called cell core. I know a lot about healing internally as well. And I know a lot of functional doctors that I find brilliant. I've been in that space for a few years now. So I do share that wisdom with a lot of patients who come see me who I think could really benefit from it. I had a girl yesterday who's been really struggling with mold and all this issues with mold big time. And the fact that she's open to telling me all this and telling me the details. And then I, of course, told her about my information for Cellcore because I know that detoxing her is going to help her in the PRI part. So I do feel like at this point I do two aspects, but the cell core stuff is not nearly as big as the PRI stuff. If I feel that the person is too complicated for me, I have a practitioner that I tend to send people to, and they always feel a difference. She's amazing. So
Yeah, I incorporate it all in my practice. I find there's a certain percentage of, you can get to a certain level with mechanical stuff, and then that biochemical affects the mechanical just as much. And so
big time.
it's important to, if you're doing postural rehab stuff and you're getting to a certain place, but it's not there, look into other things that may be affecting your system as well. So I love that you also refer or help your patients with that. Now, as we're kind of coming to a close, what could you walk us through briefly what a typical session looks like with you? Some people have seen your videos where your patients are doing like breathing with specific movements. What is it? What is kind of I know typical is not the right word, but what does a session look like with you for individuals coming in?
Yeah. So, you come in, you book the session, and I do about a 30-minute information part of history. I need to know who you are, what you do, why you're here, your history. But I really am trying to dive into who you are, because who you are might be why you're here, right? Mm-hmm. So I ask a lot of history questions. I have forms that send out prior that help me guide that portion. That's about, big part of the session. And then I do my assessment process. I do look at squat, toe touch. I look at your gait. I look at hip internal range of motion. I look at all these different range of motion testing, cervical, rib cage, pelvis, feet. And then from there, with the information I just gathered, I'm going to choose 2 to 3 techniques that I feel are going to benefit that person the best. Mm-hmm. And I'm going to give them some other information if I feel like they need cell core, if I feel like they need, to learn how to breathe through their nose. I'm going to give them information on that. I'm going to give as much information as I can. That's why I have an hour, 15, 20-minute long first initial assessment. And then the sessions afterwards happen to be shorter. So after that, they go home, they work on it for 2 weeks, and then they come back in. And I don't see people earlier than really 2 weeks because, the brain takes a little bit of time to adapt, but I'm not going to be seeing people once a week. It's just too much for me. It's too much for them. I'm not going to change techniques that early. So yeah, that's kind of the gist of it. And I think it's been very successful. So I'm going to keep it that way.
Yeah, that's awesome. Now, obviously, as with myself, we prefer to see people in person for these evaluations, but I know that you have been doing a little bit of virtual. So is that something that you'll continue maybe doing as an option for people, or where you sit with that?
Virtual is very difficult. It's taxing on me, even though in person is very taxing on me too. I don't love doing virtual completely, to be honest, but I will be doing them until I set up something, on my website, on my platform, where people can have a little bit more access to getting more out of PRI and myself. But it's going to be, I'm still working on how that's going to look. And once I do that, which will be hopefully semi soon, then I will probably stop doing as many virtual sessions. I will always probably have a little bit of virtual because I travel so much. So I do open up times here and there. But as soon as I open up a time for virtuals right now, they're being booked up immediately. So I do open up days here and there. We're like 4 hours at a time. So people can book, because I do really want to help people that can't come and see me, because it's not feasible for everybody. But I also am traveling a lot. I'm going to San Diego. I'm going to Toronto. I'm going to LA. Probably going to North Carolina, all these different places in the next few months. And I do take a table and do sessions when I can. So that's like,
Yeah.
you can just look around and hopefully see where to find me. I put it in the calendar and you can book.
Yeah,
whenever
we'll put
possible.
all of your information for people, and also possibly where they can also find a postural restoration practitioner, possibly near
Yeah.
them as well.
You
But
don't
it
have to
is
see me. There are other providers.
Yeah, for sure.
There's so many other providers out there. So just on their PRI website, there's a provider, like find a provider page and just check out if there's some in your state. There's not in every state. There's not many of us. It takes a long time to get that certification. So, you know, it's not always so feasible, but you know, we try our best.
And that's why keeping the virtual is at least to answer people's questions. I get so many virtual bookings where people just are literally asking me questions about what is the process that I start with, you know, because they've gone to the dentist, they've gone to this thing. And so having that is really helpful. So if anyone listening, you know, has that information, that's why we keep that virtual appointments open too, is to help, because we know we can't see everybody. So this has been awesome. Thank you so much for taking time out of your busy schedule to do this podcast with me today. I learned some stuff, and you also put out some amazing education as well. So where can people find you, follow you? Shout out to yourself.
My Instagram is probably where I'm most active. My name is on there is at Aleena Kanner. And then my website is aleenakanner.com. And on my website or in my Instagram, you can click the link and it will take you to Intake Queue, which is my scheduling system to book with me. So thank you so much for having me.
Absolutely. We thank you everyone for listening. We'll catch you all on the next episode. Bye guys.